And welcome to STEMFest 2015. My name is Bradley Layton, and I'm a professor at the University of Montana, where I direct the Energy Technology program. Before we get started, I want to thank you for spending time with me, Governor Bullock, and the fine folks at the Inspired Classroom, and an organization known as We Are Montana in the Classroom, who place University of Montana faculty members, graduate students, and professionals in K-12 classrooms statewide to inspire them about higher education and career pathways. Today, with the technology provided by VisionNet, we are able to fulfill this mission. This event is part of a national initiative called STEM Career Accelerator Day, being hosted by STEM Connector. You can find more about their organization at stemconnector.org. My first connection with STEM Connector came through as a result of a National Science Foundation grant I received through their Advanced Technology Education Division to enhance the educational opportunities for my energy technology students, a few of whom you see behind me, to strengthen our relationship with the Blackfeet Community College, to build connections with renewable energy technology companies, and to build connections with high school students around Montana and across the United States. You probably already know this, but the presentation you're about to take part in is a minds-on activity. So get comfortable in your seat, take a deep breath, and get ready to meet and interact with some of Montana's leaders in science, technology, engineering, and mathematics. Now, I'll hand it over to Governor Bullock, who would like to share with you his vision for the future of STEM education in Big Sky Country.
Hi everyone, I'm Governor Steve Bullock, and I'd like to thank you for being a part of the first ever Montana STEM Fest and showing an interest in a career in the fields of science, technology, engineering, and math. These are some of the fastest growing career fields in the nation. In fact, over the next decade, Montana is expected to need more than 2,000 new workers a year with skills specific to these fields. And these are good paying jobs in careers such as engineering, research and technology, architecture, and health sciences. I've been working hard to ensure that students like you have access and support to succeed, which is why we've created the Governor's STEM Scholarship Program to provide financial aid to students pursuing one of these careers. We've also launched the Montana STEM Mentors Initiative to encourage more girls to pursue a career in these fields. You all will determine what the future of Montana looks like, and your participation today means that we will have a bright one. Thanks so much for being here and have a great time.
So my name's Brent Ruby, and I'm a professor at the University of Montana. And one great thing about living in Missoula and in the great state of Montana is we have a phenomenal infrastructure for outdoor activities and all the other things I like to merge with the research that I do. What was the other question?
How does STEM impact your life?
Oh, well, STEM impacts my life from a lot of directions, mostly because that's what my whole research agenda fits within.
Perfect. Dr. LaForest?
So I'm Jenny LaForest, and I'm a physical therapist here in Missoula, Montana. And one great thing about where we live is, I was going to say the outdoors because it is great, and the seasons. You know, where I'm from the south, and so you have humidity and not great change in weather every season, and so that lets us get outside, and that's enjoyable. STEM, you know, there's so much science and technology that's always changing in physical therapy, and to be up to date on the research is kind of a constant thing for me, and, you know, we use math every day, and so STEM is intertwined. Like I said, I'm Jenny LaForest, and I'm a physical therapist here in Missoula, Montana. And just a little bit about me, I grew up in the South. I was born in Asheville, North Carolina, and I lived in Winston-Salem, North Carolina, Atlanta, Georgia, Chicago, Illinois, and then Nashville, Tennessee, and that's where I went to undergraduate. Got my bachelor's at Vanderbilt University, and then I also grew up as an athlete and got injured a lot, and so that's kind of what led to my profession in physical therapy. And I also grew up going skiing with my family in Colorado, and so that's kind of how I found my way to Montana for grad school. So let me see here.
You're good down.
Wrong way.
Here, I'll help you.
All right.
Oh, there we go.
Technology. See, you can never know enough. Go this way. All right. So what my company does, well, after I graduated with my doctorate in physical therapy from the U of M, then I started working for 5 years. I worked in an outpatient clinic, and what we generally see there is with a lot of sports injury and chronic pain, and chronic pain is not so fun to talk about. So I'll talk about a little bit of the more common injuries we saw, which is an ACL injury. Most of you probably have heard of one. Hopefully not too many of you have had one, but common with athletes, and we saw a lot and treated a lot of those in the clinic. And so this slide just kind of shows the mechanism of injury for an ACL tear, which is a ligament in your knee. As you can see, this player was pivoting with a lot of force behind it, rotated, and that's how you tear or sprain your ligament. So there's also, usually you can kind of see a lot of rotation in that, kind of where her foot's pointing, and that can sometimes lead to why we see some meniscus tears as well as ACL tears, while they kind of go together in the knee. So now I work at Community Medical Center, which is a local hospital here in Montana, and I do more of the acute and inpatient setting currently, which is, I can see anything from somebody coming into the hospital to recover from having a total joint replacement, like a total knee or total hip replacement that day, to I can be up on the ICU, which is intensive care unit for adults, and they can be hooked up to all sorts of equipment and lines, and so I can see all of that in the same day. So you see kind of a wide range of patients. And then at the end of the month, I'll be transitioning into the pediatric outpatient setting at Community, and so that is going to be also involved in the NICU. Let's see if I can get it this time. Scroll
Down. Yep, towards you.
All right. And so this kind of, get out of her head. This kind of shows how much equipment can be hooked up and on a tiny, tiny little baby. Anything you see in the ICU for an adult who's really, really, really sick, they have miniature equipment that can help these little babies survive. And so what's not shown here is a lot of times they'll be in these little kind of incubators called isolettes, and where they're totally enclosed. And so what we work through is just these little portal holes that our hands go through and kind of work with the baby, and then we shut it back up when we're all done, and that's just to keep them nice and protected from the environment around them while they're healing. And so that's just one of the cool things. I'm trying to give you kind of a wide range of what physical therapists can treat and what we can do, because there's so many different venues. You can work in a hospital, you can work in an outpatient clinic, so you can treat anywhere from babies up to geriatrics and everything in between. So there's a lot of different opportunities with physical therapy. So my aha moment for when I knew I wanted to go into PT came actually after college, but I, as I said, I was an athlete growing up, and I had lots of injuries, and unfortunately I didn't know anything about PT at that time. I never went to a physical therapist when I was competitively playing sports, and so I had some injuries that are kind of major, like concussions and jaw fractures, but the one that actually came back to give me the most grief was just that I would repetitively sprain my ankles. And so most of you probably know what that's like. At some point you probably rolled your ankle. This is just a diagram of kind of the typical ankle sprain. You can see it's pointing out all the ligaments in the ankle. I actually ended up stepping out of a really high truck and really high heels in college senior year, and that's what eventually tore all my tendons on the outside of my ankle. But it was that maneuver right there that did it. And so you can have all different grades of ankle sprains, but they really shouldn't go ignored, and you really shouldn't play on them over and over and over again, because what can happen is it can wear out those ligaments, and you can either tear the ligaments or you can actually tear the tendons, like I did. And so when I did that, and I went to the doctor, they sent me to physical therapy, and so I had my first bout with PT for probably 6 months before they did an MRI and actually figured out what I had done to my ankle. And so this is a really close-up shot of an MRI, and I'll show you just kind of, this is an Achilles tendon, which most of you probably have heard about. The Achilles is the calf muscle, the attachment there to your heel bone. And this first picture just shows a normal tendon, what it would look like on an MRI. So that nice thick black line is over here. You can see how it's connected and it's really thick. And then on this other side, you can see how it starts out black and then there's this disconnect where there's that white fluid-filled space, and that means a tendon is totally ruptured. So this is just kind of an idea of what we might look at for our patients. And bringing in STEM, we're pretty much documenting all electronically now, depending on where you work, but that's pretty much the norm. And so what that has allowed for us now is if one of your patients goes to have an MRI or an X-ray somewhere else, a lot of times we can bring it up on our computer at our clinic or wherever your workspace is, and you can kind of diagnose with them. And a lot of times, we're getting more FaceTime with the client than the doctor, and so they may not have even seen their images, they might not know really what their diagnosis means, and so to be able to pull this up and go through it with a client is pretty unique and special, and they appreciate it a lot. So basically I did that tear on a different tendon of my ankle, and that led to surgery, and so then that led to more physical therapy, and all of this was an ongoing process. I ended up having two different surgeries and PT all in between, so got to know the clinic really well and my physical therapist really well, who ironically went to undergraduate at the University of Montana, and this was when I was getting treated in Nashville, Tennessee. So he had a lot of good things to say about Missoula, and that's kind of what led me here. But anyway, so I got to be in this sports injury clinic. They were treating the Tennessee Titans in the same space, and so of course I thought that was really cool. And I noticed that they weren't at a desk all day. You're interacting with people pretty much the majority of your day, and I thought that was neat. And so I looked into it more, and for applying to physical therapy schools, you have to go do a lot of observation in a lot of different settings. And so that's when I found out that you can treat all different ages in all different settings, the hospital, outpatient clinics. Like I said, you can be in the schools as a physical therapist too. And so I knew it was something I wanted to know more about. And that's when I went to PT school here in Montana. So more than, don't know where to stand with her. She's kind of intimidating here. I'll see over here. All right. So more than just one cool thing about PT or something specific that I'm working on, it's been a lot of cool experiences since I've been out practicing. And a lot of those come from continuing education courses, which you can go to, when you're a student in PT school, but you can also do once you're out practicing. And that's when it's really fun because you're already seeing patients, kind of what your interest is, and you can really streamline, okay, I want to know more about this and what's the latest out there. And you can go to these courses, and then the next day you can bring it back to the clinic and apply it to your patients and see if it works for them and see the progress. So, all of that said, the coolest thing about PT is that you're really part of the progress for these people who, all of us have probably had an injury at some point, and it's not fun, and people get crabby, and they see you more than anybody else when they're trying to get better, and so you become kind of their coach. You're trying to get them back to what they want to be doing, and being part of that process is really fun and really rewarding, and so that's probably the best thing about PT is just making those connections with people, and they really don't forget. Some of those are really lasting relationships that you make. And then one of the other just kind of case studies that goes along with this is and the rewarding aspect of PT is I had a middle school patient who her mom had brought in because she had been diagnosed with severe scoliosis, which is curvature of the spine. It can show up in adolescence, so in high school or middle school for no reason, and it can be in all different extremes. So it can be really minor, and it can be really severe, and so you can see on this, am I going this way? No, I'm going this way. You can see on this first slide how the angle of the spine is pretty pronounced. And what they can actually do is measure, the doctor can measure the angles there of how severe a curve might be, anywhere from 20 degrees to 70 degrees. And that's kind of how they grade where what the next step is. Are they going to go to PT? Are they going to be put in a back brace 24/7 to try to straighten it out, or are they going to have surgery? And so with this child, the PT was the first intervention they had tried, and so we got to work on a bunch of new exercises, and she was really great about doing them. And within a couple months, her X-rays showed less of a curve, and so for her that's life-changing. She doesn't have to wear a back brace to school and to bed and constant, and she doesn't have to have surgery, which is really intense. And that's what this, gotta get it down. That's what this slide shows, is that bright white is actually metal, and so it's metal rods and pins that the surgeon will go in and apply into your bones, and that's what straightens out your spine. So while it's a solution, and it definitely, obviously, you can see how much straighter that section of the spine is, it's something that you will have for the rest of your life. So if you can avoid it, it's pretty nice to have the opportunity to work on other things and not have that massive surgery right away. Usually it goes all the way down and all the way up the spine if it's in adolescence. So, all right, so then what's the career opportunities? What do they look like for you guys coming out? And this is just kind of a projection in the next 5 years. What is PT, and what is going to be the need for you guys for more PTs out there? And so the red line just kind of shows how many physical therapists are going to be out there in the next 5 years. And you can see it's going up and up and up, which is a great thing. You want to know that, that's a trend, that there's more physical therapists coming out and getting jobs. You want to make sure that there's a need for all those physical therapists coming out of school. And so that's what the yellow line shows, is there's not only a need, but there's going to be a shortage of the supply of physical therapists according to the demand that's going to be out there. So that is what you want to see going into a health profession is are there going to be job opportunities out there when I get done? And so the good news is that, yes, people are not going to stop getting hurt, and they're not going to stop having surgeries, and so they're not going to stop going to PT, hopefully. So that's the trend, and it does require, a little bit more school, and it requires a little bit more student loans probably, but in the end, to have a job that you really enjoy going every day to work, and it's super rewarding, it's worth it in the end. So stick with it if you're interested. That's all.
Well,
Good morning, guys. Well, I have not done this before like Jenny, so I might look in the wrong place all the time, but I just wanted to give you a little taste of the kind of work that I do at the university. So I'm a professor at the university. I've been at the university for a while, and I do a lot of applied human physiology research. So I started out as a bright-eyed undergraduate student in Colorado, and my freshman year, I went to Colorado State University and thought, well, this sounds like a pretty good place. I ran indoor track and cross country and outdoor track and had a reasonably good experience there, but I didn't really know academically what I wanted to study. And that's pretty common in the early stages of an undergraduate student's career. It's very rare to take a high school student or even a young undergrad and they know exactly what they want to do. I then transferred to Seattle Pacific University in Seattle, and I was a pre-physical therapy major, I was a pre-med major, and then I took one class, and that was an exercise physiology course. And once I took that class, I knew, I don't know what the career fields are like in this area, but this is what I want to do. And that was kind of my aha moment. It was minor, it just happened one day in class, but that changed the direction and the path that I was on. So I graduated undergraduate from Seattle Pacific, ran track and cross country the whole time, and then I went to graduate school at the University of New Mexico with the idea of maybe staying within a clinical direction, working with cardiac patients and things of that nature. But then I was exposed to some research by these two professors that you see on the screen, Vivian Hayward and Rob Robergs, who have since moved on and or retired, because like I said, I've been at the university for a long time. So once I finished, the difficulty with the research direction is I was an undergrad student for 4 years, and then I was at the University of New Mexico in Albuquerque for 5 years of additional graduate student work. So I was in school a long time. But when I came to the University of Montana, I came to the University of Montana in Missoula as a brand new assistant professor. And the university was founded in 1893 here in Missoula. I have this bicycle. This bicycle is an 1889 bicycle. So the bicycle I have is older than the university. And so it's a Columbia Light Roadster. There you go. So I was faced with starting a research agenda completely from scratch. There were no other exercise physiology professors on campus. There was no such thing really on campus. So I started everything from scratch. I had to build a foundation for the students that our student population was growing in that field, and so I had to figure out a strategy to pull that off. So what I want to share real briefly with you is some of the research that we've done in the area of measuring human energy expenditure, looking at how that can be accomplished, how that is sometimes accomplished in field settings, and how that is accomplished within our labs at the university. So I work with a number of different agencies that provide funding for the research that we do. And those agencies, you can see, here we go, most of them are from within the U.S. military. So a lot of these agencies provide us with funding. It could be the Air Force, could be the Army, other groups of that nature. So when you think about energy expenditure in humans, there's a number of ways that we can measure this. And we have all of this equipment in our lab where we can tether people to these hoses and mouthpieces. And some of you may have seen that if you visited the university or visited our labs. But we can measure this quite easily, but that doesn't allow for quantifying activity outside of the lab. And we spend as much research time outside of the lab as we do in the lab. So this gives you a perspective. These are a lot of the facilities that we have in our lab. We have a couple of different mobile facilities, these trailers and trucks. Those allow us to go to a variety of places across the country. We also have this unit, which is a really nice torture chamber. That's an environmental chamber that we can change the temperature, we can change the humidity, we can make it high altitude, we can make it extremely sunny like a desert, and we can evaluate the human under all those different environmental situations. So this picture, this series of pictures, shows a wide range of some of the field work that we've done, from studies with endurance cyclists, studies with wildland firefighters. We've also done quite a bit of work with, here we go, over here, the military, special ops, and some other high altitude studies on Mount Rainier, and down in the corner there is Mount Evans in Colorado. So we can take our trailer to all these different settings and study humans in all these different situations. The one study, or a couple studies I want to point out to you, was this one that came out just recently. And this was a study that focused on measuring energy expenditure in average humans that are doing some pretty impressive athletic events. Those included the Ironman World Championship Triathlon in Hawaii, the Western States 100, which is a 100-mile mountain run in Northern California, and the Badwater Ultramarathon, which is a 135-mile run through Death Valley. We picked those three situations because those are three of the ugliest situations that humans can put themselves in terms of trying to accomplish big things. So what we noticed, and this graph is a little bit busy, but it gives you an idea of what the energy costs of these activities are. But let me break that down for you just real briefly. Ironman in Hawaii is about a 9,000 calorie activity. So in one day, the energy expenditure of these individuals is going to exceed about 10 to 11,000 calories in that 24-hour window, which is an enormous amount of food for humans to try to eat. Bigger than that is the Western States 100-mile run. That costs about 16,000 calories in a day, which is like 30 Big Macs. So it's really difficult for humans to stay in what we call energy balance and pull these off. Now, the one thing we noticed, and we have more subjects, more research participants than anybody else in an event like this. One thing we noticed is there's a general decline in the energy cost of the activity the longer that activity is. So this blue line shows what we see in males. What's really interesting, and we need more research participants to confirm this, the red line is what we notice with female athletes. So these are ultra-endurance female athletes. Their energy expenditure relative to their body mass doesn't seem to change as radically as males. Now this has several possible implications for ultra-endurance competition and work, but we've only started to scratch the surface of what that means. These are some of the other data from that study, or from that study series, and you can see that there's let me get out of the way here. There's very little data, here we go, except for athletes in the Tour, that bike race in France, and then Antarctica, trekking across Antarctica. Not very many people do that. There hasn't been very many measurements accomplished on those individuals. All the blue dots are the subjects from the studies that we've done. So we've accumulated a great deal of data over the last several years in this ultra world, and we're showing that humans can have similar endurance or similar energy expenditure compared to some elite migratory birds. Another really cool population that we've played around with is a group of cyclists during the race across America. The unique thing about these cyclists, and it shows what their energy expenditure was, they rode across the country in 6 days. This is their data. 6.5 days was the finish time. So they do this as a relay. Average speed 19 miles an hour, which is not any small change on a bicycle. But this group of athletes were all over 70 years old. So this is an older aged population that's doing an amazing feat of activity. So humans and human muscle is capable of a wide range of different accomplishments, from young to old. So the last bit of data I wanted to show you is from a study we did looking at using alternative food choices as a mode for exercise recovery. As you might be aware of, there's a great deal of sport nutrition products out there that promise greatness in terms of enhancing muscle recovery. I had been getting tired of that as an athlete. I was just getting tired of seeing all these different ads and claims, from chocolate milk being the greatest thing on the planet to this supplement or that supplement. And I thought, I don't think it makes a difference. We're going to do a study comparing typical fast food menu items with some of these sport nutrition products. So that's what we did with this particular study. So this is a classic project that we've done several examples of. But what we did was we took athletes and we took all their muscle out of their, or took all the fuel out of their leg muscle, obtained a sample of that leg muscle, and then we refed them twice over 4 hours. What we noticed with that study is, here you have in blue is the sport supplement products, and in red is the fast food menu item products. And what we noticed was there was no difference in the rate of muscle recovery, regardless of the two different diets, which created a bit of a controversy within the literature and within the media, because people thought, well, fast food is the root of all evil. At the same time, the sport nutrition industry, a lot of those products, I liken them to they're like the new fast food. That is the new convenient way for a lot of people to eat. And there's nothing real about that food compared to a lot of the food products that you get at McDonald's. So the other thing that's really interesting is this could become an appropriate recovery strategy in certain situations, in moderation. And we're not really making this stuff up because we've done 10 studies. We've tested over 150 subjects using this same technique. And these kind of numbers we see in all those different projects. So the last thing I'll share with you, if you have any questions, I think we'll take some time to answer some of those. But if you want to follow my lab, probably the easiest way to do that is to jump on, where is it? Here we go. Facebook. We have a Facebook page. If you just type in WPEM on Facebook, that's the best way for us to share information about the studies that we do and the type of field of study that we work within. So, thank you.
Thank you. And so now we're going to open it up to some questions. Dr. Forrest, would you please come in? And here we go. So now is the time. You guys had a little bit of time to think about some questions ahead of time.
What's the most common injury that you guys would see a year, like in physical therapy? Is that all right?
Physical therapy? Yeah. That's fine. You know, we do see a lot of back pain, and that's kind of more of a chronic issue. And then we see a lot of, like I said, probably ACLs are pretty common, and not just post-op, like not just if they have surgery, but a lot of times we would get them in to see if they even needed surgery and then rehab from there. So in the outpatient setting, that's probably the most common.
Okay, so the whole thing with McDonald's being a great recovery food, isn't that kind of controversial since people have like all these special bars and stuff for their, or like recovery foods after running and doing races and stuff?
Yeah, absolutely. That's why we did the study. The main reason for that study is to demonstrate that if menu items from McDonald's will work for recovery, guess what? Any food will work for recovery. We didn't do it as a way to promote the use of fast food. We did it as a way to knock down some of the barriers that people think the only way my muscle is going to recover is if I buy this, that, and the other product. And that's not true. You could use bananas and bagels and raisins and prunes and orange juice and accomplish the same thing.
When you did the testing for the fast food, did you also test if it affected the BMI, long-term BMI?
No, because they were only provided with a small breakfast menu and a small lunch menu. So it was just a one-shot deal. It wasn't like, oh, let's create a new supersize documentary and have these guys eat this for 30 days. It wasn't that. It was just a one-shot deal. And all these were well-trained athletes. So, again, we're not trying to say, go ahead and switch to that diet on a day-to-day basis. We're just saying, in a pinch, those food items can easily be substituted for expensive food bars and gels and other things that are mislabeled as health food. And those are not health foods either. So
a lot of people are intimidated to even venture outside towards those kind of bigger goals because they think, oh, I have to have all this special food and all this special equipment, and sometimes you don't.
No, most of the time you don't. Most athletes don't need any of those special products. They can accomplish everything they need to with average foods that you capture from the grocery store.
Are the products you use similar in calories?
Yes, it was matched. Same carbohydrates, fats, and proteins, the same breakdown. If you're interested and you shoot me an email, I can send you the paper.
Okay, thank you.
And just as a side note, along with that is that your teachers have all of your teachers have my email information, and if you have any additional questions that don't get answered, or you think about it, have a little bit of time to digest, and then want a question answered, if you send me those emails, I will go ahead and forward them to both Dr. Ruby and Dr. LaForest. So, okay.
What was the trend? I didn't quite catch that data that Dr. Had said with the length of the end, and what there was a level trend line for females compared to a decreasing trend line with males. What was that relationship again?
Well, we have to interpret that with some caution. So those are data collected during those 12 to about 60 hours worth of activity. And as you can imagine, if you're doing an activity that only lasts an hour, the energy expenditure can be pretty darn high. If it's 12 hours, it's going to be considerably lower per hour. But what we noticed in the male athletes that we studied, which we certainly had more male athletes than female athletes in those studies, as they went from 12 to 60 hours, they had a marked reduction in the overall energy expenditure per hour. Whereas with the female athletes, and again, this is a pretty small sample size, but bigger than anything else in the literature, the females showed about the same average hourly energy expenditure, regardless if the task was 12 hours or 60 hours. I don't know what that means, but I do know that the person that has gone set the record through the Appalachia Trail is a female. So maybe females are uniquely gifted for these very long endurance tasks. That's really going out on a limb, and we certainly need a lot more data to demonstrate that, but it is an interesting trend.
I would like to mention that I went to high school with her.
Oh, sweet! That's cool.
I know. Anyways.
Great
That's
question.
really cool.
Fantastic questions. All right, let's see.
So, I'm assuming you've chosen to listen in to this because you have some sort of an interest in the health sciences. You can just nod your head yes or no, right? So, what areas within the health sciences are you interested in?
Oh, interesting. Let's just go to each school. Let's start with Great Falls.
I'm interested in being a paramedic.
Can you say that? I'm sorry. Can you say that one more time?
I'm interested in being a paramedic.
Wonderful. Great. Let's go ahead to Columbia Falls.
What should I be when I grow up?
Yeah.
Like, what do you want to do?
All right. Pediatrician.
A pediatrician.
Oh, nice.
Fantastic. Let's see. Anyone from Big Sky want to share with us?
Me?
Yes.
I want to be a dentist.
A dentist.
Nice.
Fantastic. Anybody else at Big Sky? A PA.
Okay, nice.
Wonderful.
So remember, I don't think either one of us knew in high school what we were going to be. So there's still time.
Excellent, excellent. Well, everybody, it is about time for us to take off, and I know you guys have places to be as well. So I want to thank you so much for joining us at StemFest, and please help me in thanking Dr. Brent Ruby and Dr. Jenny LaForest.